A breast biopsy is a procedure designed to take small pieces of tissue out of the breast so that we can look at that tissue under the microscope. The microscope is really the only tool that can make a firm diagnosis for us. We may be able to identify a highly suspicious lesion within the breast, but without the aid of a microscope, we cannot be 100% certain whether or not a particular area in the breast is in fact malignant. A breast biopsy is performed whenever there is an area of suspicion within the breast. And those areas of suspicion cannot be fully diagnosed until we have tissue to look at under a microscope. So imaging procedures can be very helpful in identifying areas of suspicion, but they cannot make a firm diagnosis for us. Consequently, we have to rely on the biopsy to make a final diagnosis and determine whether or not cancer is or is not present. Most biopsies in the breast are performed in a radiology department under imaging guidance. For abnormalities that consist of a mass that can be visualized under ultrasound, a regular ultrasound room with ultrasound guidance is utilized to place the local anesthetic into the breast and then to take the biopsy sample. The other alternative is what we refer to as stereotactic core biopsy. In this procedure, the patient lays face down on a table, and the table has a hole in it where the breast drops through that hole, and there's a special mammogram machine underneath the table. We perform a mammogram. That mammography device is connected to a very special computer that allows us to localize the area of interest with a great deal of accuracy. The biopsy procedure is fairly straightforward and does not take much time. The biopsy procedure itself may take anywhere from 10 to 20 minutes of actual patient time. The paperwork actually takes longer to do than the procedure itself, but we generally will use local anesthesia to make the area of interest in the breast numb. That local anesthesia is actually the most painful part of the procedure. Once the local anesthesia is administered, the discomfort is really very minimal.